Federal and state health leaders are sending conflicting messages about the COVID-19 vaccine booster. U.S. Health Secretary Robert F. Kennedy Jr., a vocal skeptic of many vaccines, announced changing recommendations back in May. But Michigan's top health doctor is urging people to stay the course and get boosted. 13 News Side's Josh Albertus has that story for us tonight.
Even with the COVID-19 pandemic years in the rearview, vaccination for the virus continues. The state of Michigan reiterating their recommendation of once a year for people 6 months and older.
The new COVID vaccine provides coverage against strains that are circulating today. And number two, we know that immunity wanes.
But with some recent guidance changes from America's top health officials, recommendations are taking a different turn. In May, Health and Human Services Secretary Robert Kennedy Jr. taking to social media to announce, quote, "As of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule." On top of guidance to doctors, it's a move some have reportedly worried could also alter insurance coverage. But while the guidance may have changed, one of the state's top health officials now saying,
"The data has not changed. The data still supports vaccine use in all of those groups."
Kennedy asserting what he called a, quote, "lack of any clinical data to support the repeat booster strategy in children." FDA Commissioner Dr. Marty McCary also saying there was no evidence healthy kids need it today, and that most countries, he said, had stopped recommending it for children.
The American College of Obstetrics and Gynecology, they are probably the most respected body that gives advice to folks who are pregnant. They still recommend the COVID vaccine. The American Academy of Pediatrics is the most trusted source of guidance to our healthcare providers who take care of kids. They still recommend the vaccine.
The Michigan Department of Health and Human Services defending their recommendations, pointing to data from the CDC that found the 2023-2024 vaccines reduced the risk of COVID-19 emergency room and urgent care visits for children in the first 2 months after vaccination by 65 to 70%.
We have reviewed the data in detail, and we believe that the COVID vaccine is not only safe, but it's really effective at preventing those serious outcomes that COVID can sometimes result in.
And Josh joins us now. Josh, for people who might have questions about the vaccine, who can they ask?
Yeah, with some conflicting messages there, it seems like it can be tough to discern everything. So Bagdasarian recommended talking to your personal health care provider, that trusted medical expert, to answer those questions as vaccination continues.
That's good advice. Thank you, Josh.